Hey, everybody. Thanks for joining the Geekdom Town Hall, our first one that we're going to be hosting. And it's going to be all about our assurance testing program, pilot program, which we just wrapped up at least the first 4 weeks of the pilot program last week. Super excited to share all of the information that we learned with all of you. Let's hold off for just a couple minutes before we jump right in. Maybe give it another 3 minutes or so, and then we'll jump into the presentation. Thank you. Okay, hey everybody. So again, super excited to get started on this first Geekdom Town Hall. This is something that we're going to be doing a lot more often to share with you some of the lessons learned as we go through different quarters and months. I think obviously the first place and best place to start is talking about everything that we've done since COVID-19 hit. And so let me give you a little bit of background. For me, a few dates stick in my mind. And one of the major dates for me was March 18th, which was the first day that Geekdom closed its doors due to everything that was going on with COVID-19. Obviously, that was the right decision. That was one of the best decisions that we made to close down early to make sure that we were keeping our members safe. And then the next date that really rings true in my mind is June 8th. So between March 18th and June 8th, the team, myself, we took a lot of effort to make sure that when we had the opportunity to reopen, that we kept everybody's safety and security top of mind. I'm sure that some of you have received some of the communications that I've sent out during that time, but it was top of mind for all of us. We ended up going above and beyond and setting in place a bunch of different policies to make sure that we kept our members safe. Some of those policies, just to go over them real quick: masks are required in all the community spaces. We would have temperature checks, health screenings for anybody who came in, requiring everybody to check into the space. And then one of the other things that we did as well was make our offices and conference rooms bookable spaces for people to work from, so that they didn't have to work from the community area. They could be a little bit more safe and secure with social distancing. All those efforts we put in place helped us keep all of you safe, and it really made us feel reassured that we were doing the right thing. Rewinding the clock back to sometime in July, we met as a team, and we chatted about really what other things can we do? Is there anything else that we can do? And that's where the idea of assurance testing, we used to call intensive testing, but now we're calling assurance testing, came up. And the idea behind it was that if we could test our members and give them the knowledge that they were, either positive or negative with COVID-19, they could make the correct decisions in either quarantining if they're positive, or feeling a little bit more comfortable about returning to the space if they're negative, and then also knowing that the rest of the individuals that were in our space were negative at that time. So we really dived in, really thought through how to best approach that, had an amazing team to do that, which I'll go over with you in just a few seconds. But that team really formed what we now know as assurance testing. We started the program back on August 3rd. And we've seen some great results since over the 4 weeks that we've been doing it. And we've seen such positive results that we plan to continue to do this through the month of September as an offering for our members to be able to know where they're at with negative and positive results for COVID-19, and also feeling more reassured about coming into the space. So without further ado, I want to jump into what we're going to be talking about today, which is going over those results. So first and foremost, I would like to go over the team that really brought this to you. The people that brought it from the Geekdom side were myself and Philip, our VP of Operations, who's going to be joining us here in just a second. We also had some amazing help project managing this whole project, this big project by Catherine Slegel, or Kat, some of you might know, Chief of Staff from Geekdom Media, and then Lorenzo Gomez also really helping us a lot through the conception and the actual execution of this project. So super excited to have that entire team, and I think that everything turned out really well because of each person bringing their unique qualities to this organization. So to go over a really quick overview of what the program is doing and what the intents were, I'm going to pass it off to our VP of Operations, Philip Hernandez. Philip, you there?
Hi, everybody. Awesome. Thank you, Charles. Thank you so much. Like you mentioned, my name is Philip Hernandez, VP Operations here at Geekdom, and I'm very proud and happy to go over this program with you all. So like you mentioned, we're calling it the assurance testing, and this program is an innovative approach to reopen businesses by frequently testing the community. Our goal is to instill confidence in our members so that they can have an additional data point to feel comfortable about making the decision to come back to work. So everybody coming to work at Geekdom is tested every 7 days and provided rapid results within 24 hours. This is really fantastic and a great opportunity for us because one, it's difficult to get a test, especially if you're an asymptomatic individual, but also once you get that test, it's difficult to get the results in a timely manner. And we were lucky enough to partner with the lab to make that happen. So if your result's negative, then you're granted access into the building and returning to work. If the result's positive, they isolate and quarantine for 14 days before they can schedule their next test. The test we use is a mid-turbinate nasal swab for sample collection, and we partnered with a local lab to do the extremely accurate PCR test. And so for those of you that haven't gone down to visit Ellen, who's the wonderful lady who's been helping us administer these tests, it's actually not the one that goes super far back, but it's also not the one that's super shallow. It's kind of right in the middle. Not really painful, but it does make you sneeze a little bit, or at least have that feeling. And so, like I mentioned, we contracted medical professionals to come and collect the samples from our participants. We did this on site in the Geekdom Event Center 3 days a week, Monday, Wednesday, and Friday from 8 a.m. to 1 p.m. And those medical professionals, we had, like I mentioned, Ellen, she was a retired RN who's been gracious enough to help us with her time, her knowledge, and her experience, as well as our team of 2 EMTs who have also been there to assist with the collection and with making sure that the samples are kept in a secure fashion so the lab can pick them up. Something else to mention about the 3 days a week, when we started, we were only going to be testing Monday and Wednesday, but because of the early adoption and the feedback that we got from our members, we were able to extend it. And I was really proud of that. I think that spoke a lot to our operations that we were able to scale out that quickly. Also, so the lab, they send a courier to pick up those samples at 2 p.m. every testing day, and then we get the results later on that evening. The participants all have the results in their inbox by the following morning. That's actually a really remarkable thing. They would pick them up at 2 p.m. We would actually get the results usually before midnight, which, to measure the time that you get your results in hours versus days is not something that's easy to find right now. So we're really proud to have that strong partnership. And then, like Charles had mentioned, throughout this whole time, all existing health and safety protocols were still in place throughout the program. So if you came in to get your test, immediately you got your temperature taken, asked about all the symptoms, masks were required, hand sanitizer provided, and that's before you even take the test. And then once you get your result and you're cleared to go into work at Geekdom, you would go to the 7th floor and do the natural check-in that we had in place, which were all of the things that I previously mentioned, and then also a health assessment to make sure that you get all the green checks and you're able to come in. So with all of those things together, we really feel like this has boosted confidence, and I'm excited for Charles to get into the results here in just a minute. I do want to talk about the measurables because we put a lot of thought into this beforehand, so that we knew how to measure our success and really see if we were doing this right. And so some of those measurables were the number of tests scheduled, and that was to measure the adoption of the program. So for those not familiar, if you participated in the program, you were sent to book a time slot where you can come in and take your test. And then also, we measured the number of tests administered to measure our operations. So sometimes we would have a no-show or a reschedule, or more likely we had quite a few walk-ins, and we were really happy and proud that we were able to accommodate those. Also, another big measurable for us was the average daily check-ins and reserved spaces to measure the change in member behavior. So we wanted to see if there were truly more people that were coming to use our space. And then, like Charles had mentioned, we had made a lot of our spaces bookable. And so we wanted to see also how many people were using those resources. And then obviously another measurable that's kind of black and white for us is the test results. We wanted to see how many negatives, how many positives, how many known positives, which we'll get into here in just a little bit. And then also just kind of see if people show positive, when do they come back negative, and vice versa. And then lastly, a major measurable for us was we wanted one of the main goals for this was to prevent the community spread. And so we were really happy to report that we haven't had any of those, and we'll get into more of the results shortly after this. So those are some of the measurables. That's a little program overview. So even though I'm VP Ops over here at Geekdom, the last quarter, I largely spent most of my time digging deep into the ops of this program. So I'm happy to answer any questions anybody has after this. And also, we have a lot of documentation that was created throughout this whole thing. So if anybody has any interest in sample collection in a private entity, which I believe we're the first to do this in San Antonio. So if you have any questions on that, I'm happy to speak about that, how we adjusted our operations, how we shifted our focus, and also how we were able to maintain operations on the Geekdom side. So with all that, thank you all so much for your time. I'm going to pass it back over to Charles so he can go over the results and findings.
Awesome. Thanks, Philip. Really appreciate everything that you did to really get this thing off the ground and making sure that the ops were run as well as they possibly could. I cannot tell all of you watching just how seamless this process was because of the great work that Philip did, Kat and Lorenzo. So just great work, everybody. So I'm excited to go over the results with you, but the very first thing I do want to stress, which Philip had said was one of the major focuses of this, was really to think about a co-working space and to make sure that community spread was not going to be an issue here. And that's why this assurance testing was so important, to really suppress the spread with anything that happens here in the space. And that's the happiest thing that I have to report, is that we haven't had any community spread within the space. So we're really excited about those results. But beyond that, as Philip mentioned, there were some other measurables that we went over. And so I'm going to go over those with you guys real quick. So first and foremost, as Philip had stated, we really wanted to find out how many tests we were giving. When we first plotted this out, we really only built capacity for 60 tests in week number 1, but we quickly realized that was not going to cut it based on the feedback we were getting from our members. So we quickly pivoted and we're able to build out up to 90 tests in a given week. And so as you see of the results page here, our first week, we had 83 tests given. You will see a little dip in week number 2, and that was mostly because of our our partnership program, Students Plus Startups, had a bunch of the students that were taking part of this testing program take a week off. Some of them have come back as a part of the fall semester, but there was a little break in that. As you see in week 3, things picked up pretty dramatically, back up to 92. And then we closed out last week with 106 tests, which is pretty impressive considering that we only really built out the capacity for 90, really, again, stressing and showing the success of operations being able to handle those many more individuals walking in, above and beyond what we had the capacity to be able to do. Now, real quick, going over the negatives and positives, we did have 3 positives in week number 1, and 2 of them were what we call known positives, which I'll dive in here a little bit deeper when we get the lessons learned. But we also had 1 asymptomatic individual who did test positive in week 1, quarantined for 14 days, came back. Week number 3, tested negative. So we're very happy about that. But beyond that, the other one tests that you see popping positive on week 2, 3, and 4 were known positives. So that was a really good thing that we learned really early on, that some of these positive results will continue to be there even outside of contagious window. The daily check-ins was a way that we as a team are really measuring the use of the space. And so we really wanted to find out average check-ins. Average in July was approximately 20. And so immediately you can see that there was a tick up in week number 1. Week number 3 jumped up, and then week number 4, we had a grand total of about average of 31 individuals checking into the space in a given day. During week number 4. And so far this week, it seems like there's even more. So we're seeing great results as far as people feeling comfortable coming back into the space. And then the other thing was, as Philip had mentioned, as I mentioned earlier, we did set aside offices, conference rooms, and things for people to be able to book out space and keep that social distancing as much as possible. As we saw, our capacity in that went up dramatically, or sorry, the filled space went up dramatically in week number 4, and we got up to 81%. Because of that, and because of the positive results that we've seen and the positive feedback that we've seen from our members, we did decide to open up the community space for booking on 7. So that was one of the other positive results that we saw from this. You will see in the other breakdowns some graphs just showing you a little bit of the growth that we've seen during this period of time. But the other thing I do want to focus on is our NPS. We really wanted to find out whether or not this made our members feel safe and secure, made them feel more assured that they were not going to be contracting COVID-19 by coming in here, by abiding by our policies and procedures. And as you see from our NPS results, we had a 92 positive, which is really great. So super excited about all those results. Next, I want to talk about our lessons learned. So we'll shift over to those. And I mentioned a couple of those already. And one of those first was, well, actually, let me take one step back. One of the first things that we learned as a team was, with something as big as this, as something as profound as what we were doing, innovative with this testing program, we really realized very early on that communication, over communication, was very, very important. And so we did try to over communicate before, during, and now after this this testing pilot program, to make sure that all of our members really knew what was happening and how things were going. With all that being said, that was one of the major learning lessons. The next one was the known positives. And so individuals who did test positive and had already quarantined for 14 days could still test positive using the PCR test because of how accurate it was. And so because of that, we did have 2 people that still tested positive even after they had gotten outside of that window. And that was one of the things that we learned in week number 1. And it was something that really changed how we affected things, and realizing that a symptom-based return to work policy was one of the best procedures. And so if you did test positive, you were outside of the contagious window, you could get a doctor's note to say that you are cleared to be able to come back to work. And that was one of the learning lessons that we had. It was a really great thing that our team picked up on very early. The other thing was that we did have one individual who did test positive, is asymptomatic, went in quarantine for 14 days, came back and tested negative. So that was a really good result, showing that the process worked. And then last but not least, one of the things that we did realize is, for us to really control and understand the use of the space, having several different options for people to be able to enter into the space was one of the issues that we need to solve for. And so right now we would have fobs, proximity application, and then others being able to let people in. And we really wanted to make sure that we were getting as much data and clear information as we possibly could, again, for the main concern of safety and security of our members. And so that was one of the other lessons learned that we have had, that we plan on addressing here in the future. So again, those are the lessons learned that we've had. Last, I do want to go over what we have plans to do here in the future. Once we go over that, I do want to stress that we are here for some questions and answers. So if you have any questions, please put them in your wherever you're watching us, whether it be social media. And then also there should be a link that directs you to our forums, where we will be doing an AMA after this. So please go ahead, go to the forums, put in your questions there. Philip and myself will spend about a half hour after we conclude this being able to answer any of the questions that you may have. So please don't hesitate to jump over there and do it. So moving forward, as I said earlier, based on the positive results that we've seen, the positive feedback, one of the things that we started to do was open up the 7th floor community space for booking. And we plan to do that in phases as the capacity continues to increase. Again, really stressing social distancing, and all the policies and procedures that we have in place. So that is going to continue to happen, but we're really excited to start seeing people in the community space on 7 so far this week. So it's a really great positive result. Also, access control, as I just mentioned in our lessons learned, that is something we as a team are taking on for a Q4 solution. So right now we do have proximity application, which offers some amazing opportunities for people to be able to enter the space, and for us as a team to really track and understand who's in the space and how the space is being utilized. So we're gonna determine and figure out and roll out a plan on what system we're gonna be doing going forward, which more than likely will be the proximity app, but more to come on that. And then also we're working on, as a team, a solution to be able to offer individuals access to the space beyond the period of time that we're open. So right now we've limited the space operations from 8 to 5. And really what we want to do is we want to be able to let some of our members return to the way that they used to work, which was at all hours of the time. And so we're working on a plan to be able to do that. So you can expect to see some of that coming in the not too distant future. Really excited to be able to offer our members that. And then last, for us, I think we can all agree that this COVID-19 time period has been a distraction, and excuse me, and we as a team have really taken the thoughtfulness to make sure that we address all the concerns about it. But now it's time to shift our focus back to why we're really here, building San Antonio one startup at a time. And so our focus as a team are going to take this success, this win, and we're going to turn our focus to how we continue to offer all of you, our members, the pathway to success, to create your next startup, to get your idea from just that, an idea, to a viable business that's ready for the next level. So that's why we're here. That's what we plan on doing. And that's the commitment I can give to you. And we will continue to do these town halls as more information comes out and things that we can share with you. So without further ado, Philip and myself will offer you guys the ability to ask some questions. But before we do so, I just really want to say thank you. Thank you all, everybody who's participated, everybody who's given us feedback, all of our members for staying engaged during this really weird time that we've been living in. Can't say thank you enough. And we're really excited to find out what we can do here together in the future. So Philip and I will go to the questions. Do we have any questions right now?
Charles, I've had a question that's come up numerous times, and I want to give you an opportunity to speak on it. So with the pilot program being a 4-week program and us concluding the 4 weeks last week, is the program going to continue? And if so, do we know how long?
Yeah, great question. And the answer is that we are going to continue this. When we entered into the partnership with PRL, Pathology Reference Lab, we did secure enough tests to be able to test our population. Those tests should last us at the very least through the month of September. So we are committed for our members to be able to continue this testing program through at least the month of September, and then we'll address what comes after that. One of the other things that I'll take an opportunity to talk about real quick right now is that we really had hoped that this pilot program would be an example for other companies, other entities to really take this and run with it. And Philip, myself, and some of the other team have been hosting calls every Tuesday for interested companies in around San Antonio that had heard about this program and wanted to learn more. And so through those programs, we've had some amazing conversations with other companies that we're hoping are going to pick this up. And our thought process behind this is that we believe that through the success that we've seen, that this is a possibility for other businesses to continue to assure their members, their employees, that it is a safe place to return to with this new information and data from testing.
Right on, Charles. Looks like another question came through. And I'm happy to take it unless you want to answer. How can other companies who are interested get more information, get involved in what we're doing and any of our findings?
Please take it.
So yes, like Charles had mentioned, we do have a standing call that's been happening weekly. I imagine that those will continue. If nothing else, we might spread them out a little bit more. But we have found a lot of things. Like I said, we do have a lot of documentation on it, and we have been ingrained in this for the last quarter. So we're happy to talk about this. It's an exciting thing for us. So if you do have any questions about it, please feel free to email myself. I'm philip@geekdom.com. You can email charles@geekdom.com. And we also have an email address that's set up specifically for testing@geekdom.com. I think the quickest and best way to get a hold of us is if you email myself or Charles directly, and we're happy to answer any of those questions. We can go over a similar presentation like this, or just have a more conversational approach. We're happy to do either one. But yeah, with that, I do want to just give a huge shout out and a thank you to our leader and CEO, Charles, for leading us through this. This is it has been a difficult time, but it's been really inspiring to be able to remain open and to still be able to serve our members and to serve the startup community. So I'd like to conclude this, at least this portion of our presentation, just to echo Charles and saying thank you to everybody. Thank you for not only your time right now, but for believing in us, for participating in this program, for continuing to come in, show face, and still abide by all of our protocols. I know this has been a lot. I know there's been a lot of changes, and it really takes the whole community to adopt these things and participate so that we can continue to work together safely. So with that, let's continue the conversation. Let's continue collaborating. Please join us on our forums. Charles and I are going to be on there at least for the next hour, answering any questions that y'all may have in real time. So that's it for me. Thank you all so much. I appreciate everybody.
Thank you.